Thank you so much. I have some specific notes of gratitude I would like to make first. So bear with me, and I hope you enjoy your dinner while doing so. So first and foremost, thank you to the Lown Institute for this incredible honor. It is humbling to receive anything tied to the name of Dr. Bernard Lown, a pioneer in mobilizing physicians and the public to collectively organize and advocate on behalf of patients worldwide. I'm also honored to be in the footsteps of prior awardees, including Dr. Cervantes, who throughout her career has been emblematic of the lessons imparted by Dr. Lown. Thank you as well to Dr. Joseph Ross, who nominated me for this award. Joe has not only been an exemplar of how to conduct impactful, rigorous research, but also in being a mentor above mentors. For over a decade, I have been so lucky to benefit from his steady guidance, his incredible generosity with his time, and I say that not so lightly. He is a huge bigwig with many responsibilities, so I'm very lucky to have his time, and his profound thoughtfulness that always makes ideas better and more meaningful. Thank you as well to Angie Baki, the Executive Director for Doctors for America. Under her leadership, DFA has shown courage in taking on challenges on behalf of our patients that other organizations have shied away from, especially now. Thank you to Destiny Tolliver, who you'll meet, my former co-fellow in the Yale National Clinician Scholars Program, and my Zoom writing partner. Since we've met, she's been an inspiration in her research and advocacy to stop the school-to-prison pipeline. And thank you to the many collaborators, colleagues, mentees, mentors, and friends I've had the privilege to work with. This award is really for all of you. And a very special thank you to my husband, James Cormie, who has been my stalwart supporter in so many ways. There have been many mornings, many nights, and many weekends where he has stepped in to get our little ones to school, to activities, and to bed so that I can do this work to hopefully make the future a bit better for them. Most importantly, I want to say thank you to my patients who have, since the start of my medical career, have taught me so much and have compelled me to do the work that I do. 3 in particular have stayed with me, having shaped my experience as a clinician, researcher, and advocate. In 2009, after I started medical school, I met my first patient. Our school allowed us as first-year medical students to meet with patients alongside a longitudinal clinical mentor. And it was here I met Alicia, a 23-year-old woman who had been hospitalized because she couldn't breathe. She had been diagnosed with asthma since she was a child. But when I met her, she did not have health insurance and could not afford to pay for an inhaler out of pocket. She had come in and out of the emergency room and hospital multiple times when her asthma acutely worsened and she could no longer breathe. Each of these visits resulted in another bill that she could often not afford to pay. And medications prescribed at the end of each stay were left at the pharmacy counter because she needed the money for the next month's rent or food. In 2010, after the Affordable Care Act passed, she was able to get health insurance. She could schedule appointments with her primary care physician and a lung specialist to assess the severity of her asthma, but from these visits, she would receive new prescriptions for new inhalers. However, she soon realized that even with insurance, she could not afford to pay for them. I saw her once again in the hospital, and I had just learned about patient assistance programs, where pharmaceutical companies for eligible patients would offer their manufactured medicines at low or no cost. Together, we filled out a mountain of forms and faxed them over to various drug companies that sold the inhalers she needed. But she was denied again and again, leaving her without access to this life-saving treatment and continuing to come to the emergency room for her all too frequent asthma flares. I became increasingly frustrated. Wasn't the Affordable Care Act supposed to solve this problem? Unfortunately not. Health insurance access did not mean health care access, including for life-saving asthma medications, even those that have been on the market for decades. A few years later in residency, I was taking care of Mr. Brown, an elderly Black gentleman who had been hospitalized for falls. After extensive testing, we found that his prostate cancer had relapsed and spread to his bones, contributing to these falls. When his oncologist told him that he needed to immediately start taking enzalutamide, a treatment for prostate cancer, he became quiet and only replied that he would think about it. As I was able to get to know him over the course of a prolonged hospitalization, I found out why he was reluctant to take the medication. He had taken it before, and the cost had made him nearly destitute. Even with his Medicare coverage, he paid over $400 per month in out-of-pocket costs. He told me that this time he might need to ask his son if he could borrow money, but he was too ashamed to do so. Enzalutamide was a known drug to me. It had been discovered and developed just a few miles away from where I was training at UCLA, with the support of funding from the National Institutes of Health and the Department of Defense, before the university licensed the drug exclusively to Pfizer and Astellas. After FDA approval, this no-strings-attached deal allowed the company to sell the drug at almost $200,000 for a single treatment course, a price that failed to take into consideration the significant amount of taxpayer funding, including from Mr. Brown, that led to its discovery and development. Patients just like Mr. Brown, who had been suffering from prostate cancer and facing difficulty affording the drug, had petitioned the US government multiple times to intervene and provide a more affordable option. However, the petitions, including the most recent in 2024, had all been rejected. Mr. Brown ultimately forewent his treatment. After subsequent hospitalization for a traumatic fall, he was ultimately moved to hospice and passed. During fellowship, I met Mr. Jones and his family. They first came for an urgent visit, concerned that he was losing his memory. After a series of visits with me and other specialists, he was diagnosed with Alzheimer's. At a subsequent visit, his family came into the exam room joyful and with a set of printed papers. They had received an email alerting them that aducanumab, or Aduhelm, marketed by Biogen, had been approved by the US Food and Drug Administration, or FDA, for treatment of Alzheimer's. After a series of questions online linked through this email, they were recommended to come speak to their doctor, me, about getting Mr. Jones on this newly approved drug. Like many others, I've been following this approval closely. 6 months earlier, when FDA had convened an expert advisory committee, and there was a near unanimous vote against approval, I felt reassured that FDA would not approve this drug. Not only did FDA officials as well as independent experts note its lack of meaningful clinical benefit, but also its dangerous side effects, including brain bleeding, brain swelling, and death. Despite this, FDA proceeded forward with approving this drug. And Biogen also announced the price of aducanumab at $56,000 per patient per year. A public outcry ensued, with organizations and others saying that the high price would hurt access for patients and ignoring the underlying concern that the drug was seemingly not effective nor safe. Due to this public pressure campaign, Biogen cut the price by half. In the same week of aducanumab being approved and Biogen backtracking on its initial price, I had one of the most difficult visits I've ever had with a patient and their family. They understood that there had not been a treatment for Alzheimer's, but at this visit, they came in hopeful that their loved one would get access to this new drug, painted by Biogen and FDA as a cure. Painstakingly, I walked through what I knew about aducanumab and the concerns that I had, that if I recommended this drug for Mr. Jones, not only would his memory loss not improve or slow down, but that I would be causing him harm. It became clear to me that affordable access was not mutually exclusive from what our patients have access to. And institutions like FDA, which set the bar for what is safe and effective to be made available for patients, have a critical role and responsibility to shaping meaningful access for our patients. These 3 different patient experiences throughout my career have not been one-offs, but have been repeated again and again in the lives of others. For me, these patients are a reminder that our healthcare system has and remains broken. It is these all too common experiences that have led to the pervasive mistrust in our public health institutions. And it's a reminder that there is common ground between me, us, our patients, and the current parallel movement that is voicing their doubts in public health institutions and pushing for seismic changes, however misguided they might be. In fact, those responsible for this mistrust have not changed and have only been emboldened by current policies. The erosion of public health agencies like the NIH, FDA, CDC, among others, has made us more reliant on private actors who see the current landscape as an opportunity to extract more and offer even less to our patients. We see this in their support for mass deregulation that removes long-standing safeguards meant to protect patients to benefit those who only seek to profit. We see this in their aggressive efforts to provide essential services, such as healthcare, creating unconscionable trade-offs between their profits and better care, better access, and lower costs. And we also see this in their silence as public capacity, including technical expertise, data, and other resources are being purged left and right. And increasingly, we are turning a blind eye to this encroachment and continuing to defend a status quo that has failed to work for our patients instead of offering a new vision. But it's not too late to fight back and to do so as Dr. Lown would have. he would have recognized that there has been a movement that has brought us here to the current challenges that we see today, and that only a movement will get us to the other side and to a better future. He would have recognized that our strategy to date in addressing health challenges of tinkering at the margins to assuage every other stakeholder and putting patients as an afterthought has not and will not work. He would have mobilized clinicians and the public to not only protect the missions of public health institutions, but to also transform them. I have one last personal note of thanks and dedication for this award for my father. He unexpectedly passed last year, and since then, I've thought of him often. He exemplified persistence, just as Dr. Lown did, in coming to the United States and giving up a more comfortable life as a professor and restarting his career as a postdoctoral fellow, pivoting from being an agricultural scientist specialized in plant genetics to becoming a cancer research scientist, getting an MBA when I was in college to keep learning and to bring his research to new audiences. And then towards the end of his career and even during retirement, designing clinical trials to test the compounds he discovered as a basic scientist. My dad never hesitated to call out injustice, especially in his later years. He dragged my mother to protests about gun violence prevention and healthcare. He wrote messages to his legislators, especially when he was displeased about what they were doing. He would text bank on various issues and candidates, hesitant to phone bank as he was sensitive about its accent. And over the past year, when it seems like there is no end in sight to the extent of injustice that we are witnessing, I think of him, and I know that he would be still going to those protests, still writing messages to policymakers, and still calling on others to join him in these efforts, not just to secure a better future for himself, but for everyone else. He would also be proudly texting me and sending me pictures about all that he was doing. This is my hope and my dream, that we all can follow in the footsteps of my father and Dr. Lown to not only fight right now, but to also build, without limits to our imagination, a public health system truly centered around our patients. Thank you.